Hello, in this video we're going to look at my top 10 tips to pass the AKT. And stick around at the end because I've got a really good document that I've pulled together to try and really help with your AKT review. First one, really obvious, read the question. The way the AKT is structured, sometimes one or two little questions or one or two little words can often really swing the question in terms of what they're looking for. And on previous RCGP feedback reports, I've even commented that the units weren't added when they're asking for drug calculations, so really read what is the answer that they're going for. Number two is to look at common drug side effects, so just the main ones that you're looking out for, because they often base questions on that. So for example, in this one, a question about asthma might be related to potassium and sort of how that is affected by the treatment of salbutamol. Okay, so you sort of need to think, right, okay, well, I've got this condition, what's the very common medication that we're going to use, what are the common side effects of it? Number three is to really make sure that you are up to date with your clinical knowledge. Don't do what I did and get overexcited on the statistics and really focus on that. That's because your clinical knowledge accounts for 80% of the actual exam itself, with only 10% being given to the administrative side and also the sort of the statistics and evidence-based side. So if you're naff at either of those two latter parts, really don't worry too much about it. Just try and nail the clinical element to really boost up your marks. Next is to give plenty of time for revision. Don't try and cram it and leave it to last minute. Big question is, how long should you give? Well, I would initially recommend around 3 months that you're giving consolidated revision for. But, and the big elephant in the room, is that some people may need to factor in more time due to their own circumstance. So think, could that be you? Are you looking after someone else? Have you got elderly relatives that you need to look after? Have you got young children that you need to sort of factor into this, that you can't give the same time and effort that you may have once done, say, in your last exams, which may have been as far back as university? A simple one for number 5, answer every question. It's not negatively marked, so you're not going to be you're not going to have any disadvantage if you get the question wrong. Just make sure you answer it. Just a quick note to say, if you're really finding this information useful, please subscribe to the channel. It really helps, and also leave any comments below for any future videos that you would like to see. With regards to the questions themselves, you've got around 57 seconds per question, so get into the habit of being able to answer questions quickly off your head, basically. You might find that questions will need more time, and so if you're quick at answering certain ones that you're confident with, that will allow you more time to have a look into the ones that you're not so sure. This one really bugs me. You need to know the basics of general practice inside out, and what I mean by this is your asthma, your hypertension, your eczema, the stuff that you're seeing in primary care day in, day out, regardless of whether you're an ST2, 3. If you're seeing common stuff in general practice, you need to be confident in managing those conditions, effectively your bread and butter. This pops up on the RCGP feedback reports time and time again, that basic conditions candidates are getting the answers wrong to, so make sure you know these. RCGP base the questions on limited sets, so whether it be SIGN, the BNF, stuff from the RCGP, NICE guidelines, Cochrane reviews, and also the BMJ itself. So if you're revising stuff from some weird and wonderful places, or sort of like really brand spanking new journal articles, just be very careful before you go answering questions. Number 9, a bit of a one that trips a couple of candidates up, and it has myself, is to make sure that you're learning national guidelines, not local guidelines. Every hospital, say when you're referring to, has slightly different rules. Okay, in big handfuls they're going to be the same, but there might be some slight nuances that are changed. Okay, so just make sure that when you're revising stuff that you're using the national guidelines, and you're not, say, basing it off local, say, referral forms that you think like, oh yes, I've got that nailed. Okay, because that might not be the best. At least for number 10, this might be one of the first exams that you've done properly outside of university. Yes, you would have had revisions for certain entry-level exams, but it might be you're going to have to work slightly differently. As I mentioned in previous ones, you may have young family, other commitments that you need to sort of spend that time with, so you can't give the same sort of dedication or sort of hours that you may have done at university. So you need to maximize your free time that you've got, whether it be with podcasts, questions on your phone, or other sort of devices that you can use just as you're sort of working day to day, so that you're maximizing these free moments. I would also look at focusing on where the others have failed and having a look at the RCGP feedback reports, at least for the couple of reports prior to your exam, so that you know where to aim your screenshot of it down here below. Effectively, after every exam, once they release the results they will release a PDF document and as part of it, they will show a couple of paragraphs of where areas for candidates causing difficulty, and they'll go into detail about the certain clinical areas that sort of the whole cohort of that exam failed with. My argument is, and as my trainer taught me, is that if other people are struggling with this, the RCGP are likely, though not promised, to ask those questions again. So make sure you have a look at it. You've got plenty of time to make sure that you're really clued up on those areas. As I said before, you might have to revise differently, so use your resources about you. VTS is great because you'll often have a group of people who are in exactly the same situation as you. It'll only take anywhere between 2, 3, 4, 5, 6 of you. Set up a WhatsApp group, throw out questions, share resources with each other, do question and answer sessions when you can. And don't forget, there are some excellent external companies that have done a lot of the sort of almost the revision for you. I personally use Red Whale, but there's MB Medical Education out there as well. And what these companies do, they will consolidate all of these guidance, whether it be from NICE, CKS, Sign Guidance, and put it into a consolidated format that's really easy and sort of manageable to read. So let's talk about this bonus that I gave you. First and foremost, you're going to have to go to the link below, gptemplates.co.uk, and go onto the GP VTS section. So you've navigated to gptemplates.co.uk, head on over to the GP VTS section, scroll on down, and you'll see the AKT revision guide. Now, using the stuff that I've learned and from dealing with other registrars, I've gone through and consolidated the stuff that you need to know. Okay, so this goes through the question types that you may have. It will look at also some revision tips, certainly sort of expanding on the 10 that I've given you here, plus a whole wealth of more there as well. I've also consolidated a list taken from sort of other sources that I found that will be really useful in giving you a revision guide of where you should start with your revisions. Plus, it sort of talks about looking at smart strategies to make sure you really refine your revision and that you're maximizing your opportunities.